There you go. So thank you all so much for coming this evening. Like I said, I'm really excited to have Dr. Beulah with us this evening. I'm very lucky because she's actually a good friend of mine. And it's through our friendship that she's been sharing so much with me about the work that she does. And every now and again when we're chatting, she just gives me a different insight with her background. And I'm going to let you introduce yourself and share your background. So I'm just sort of like saying how much it's helped me in a lot of the work that I've done. And that's why I'm so excited to have you here. And thank you so much for joining us this evening to talk about this incredibly important subject of sucking. And it sounds so simple when you say we're just going to talk about sucking, but I know from the conversations we've had how incredibly important it is. And I'm really looking forward to this. So thank you very much for joining us this evening.
Thank you for the invitation and for you, all the other mothers in this period to sacrifice your evening. I know it's almost bath time, bedtime, relaxing time. Your body's probably aching by now after the day. But yeah, thank you, Karen. My background is mainly, I'm an educational psychologist who went on to specialize in neurodevelopment. So I'm seeing children slightly older than yours. They arrive on my doorstep anything from 3 years and onwards. And that's usually when we start to see components that might indicate a neurodevelopmental delay. So it's really fantastic for me to talk to you prior to that period, and also just to understand the importance of sucking, as Karen has indicated. So I'm just going to share my screen, and as I've said earlier, it's not a webinar, it's just a chat about the importance of sucking. So Karen, I just want to check, can you see my screen?
I can see you and your screen, so that's perfect. Thank you so much.
Fantastic. Okay, so I'm going to talk to you about sucking from a neurodevelopmental perspective. In other words, we all understand the bonding component and the nutritious component, the nutrition component. So all of that, I think you've got down. And I know that Karen will be able to assist you if the baby does not want to suck immediately, or, you know, after a period. So I'm not really going to focus on that. My goal for tonight is really just to create an awareness of the importance of sucking. And as we came in, I think Jacqueline mentioned that, you know, it's like, it can be a controversial subject because there are those who would like to encourage sucking, like dummies and so on, and those who say, no, don't. So I'm just going to give you the information from a neurodevelopmental perspective, and then you as a parent can then start to make an informed decision about is this good, is this not good. Okay, so let's then just start. There's a sequence, as with anything neurodevelopmentally, there is the specific sequence, and the sequence is extremely important for us to understand what this normal developmental process is. It is also our indication to create awareness in us if that development does not take place the way it should, and then obviously what to do afterwards. But in general, sucking is one of our first neurodevelopmental activities that we perform as human beings. It's got a vital role, and you can always tell the importance of an activity if you look at where it sits in this whole developmental process. So there's a rough outline of the developmental sequence of sucking. So the first one is where we have, and remember, whenever I plot something, it's not necessarily where you first see the presentation of an activity, but more so in terms of when the neurology starts to prime itself for this activity. So roughly 4 to 5 weeks in, we already see the first responses that will ultimately lead to the act of sucking. And this cutaneous withdrawal reflex that's actually part of the it's a tactile reflex. So in other words, if you were to enter the womb and that area which would become the upper lip of your baby, if you touch that part, then there would be this natural withdrawing from this stimulation. And it's very interesting to note that the first tactile response is that of a protective response. In other words, it's a defensive response, which also then indicates to us the importance of where it lies in the brain. The first information would go to the survival mechanisms of the brain, and it sends survival signals. That is why it is a defensive type of response. And then that will develop, or that sensation, sensitivity of that sensation will then start to move over and become part of the whole face. And then obviously then it will spread to the palms, the sole, and then later the whole body. So it is important for us to remember that this is then, as I've said, a tactile. It starts with a tactile component. And if you think about skin, it is the largest organ of the body. So if there's something there that is overly sensitive, then it can really affect a large part of the brain. Because if you think about the homunculus, which is that representation of the body in the brain, so each part of our body is represented in the brain, then the mouth it takes quite a large portion of that sensory motor strip. So it illustrates how much information the baby actually derives from this whole oral motor component. But then just to come back to our sequence, it develops very, very early on, and it develops as a withdrawal reflex. And then that moves on to our primitives, our official primitive reflexes. And here you can see we've got reflexes like the palm of the plantar, and there we have our reaching reflex, which is the precursor to our sucking. And you can see here in terms of weeks where it starts to develop. And then our next one is the sucking reflex, where it starts to develop. And roughly here by 32 weeks, we want to know that it is established. And sometimes you will even see your baby sucking on his thumb or his fingers or his toe in utero. So it already should be there, and it primes itself for when they've got to feed. Now, in terms of the importance, as I've mentioned, this sucking is one of our first neurodevelopmental activities because it starts to build the building blocks. So whenever we talk about neurodevelopment, then in general, the definition for that is the development of the brain and the spinal cord. In other words, the act of sucking develops the brain and therefore the functioning of the spinal cord, because there's information that will be moving from the brain to the spinal cord and stimulation like that. So every time you stimulate that area, obviously the spinal cord is also stimulated in a way. So I've spoken about the reaching reflex. Now, I think you all know about the reaching reflex. It's that reflex where when you touch the side of the cheek, the baby will spontaneously move towards the stimulation. So now you can already see that sensation has moved from a withdrawal reflex, in other words, a pushing away, to a moving towards. So there's already an indication to you that there's a major change that took place. In other words, from this overly sensitive activity in terms of protection to a moving towards, not knowing that it is really for nurturing or for sucking, but it is a movement towards stimulation, which is extremely important because we derive our information and our understanding of the world by approaching information. if we were always in a defensive mode, that would be extremely difficult for us to gain information from our environment and from our world. So as you can see here, roughly at the 32 weeks in pregnancy that is fully emerged, and then at 36 weeks that should be fully developed. Now, first, it is a reflex. In other words, there's no cortical involvement. The baby doesn't think about how to suck. It doesn't plan to suck. It is a stimulation, and a reflex. The definition of a reflex is it's a sequence of events that's not under cortical control. In other words, it happens reflexively. The baby can't plan it, cannot think about it. It just happens. And then if all those primitive reflexes, if they've fallen into place and if they developed the way they should, then they would actually assist with secondary reflexes. In other words, it's like little steps in the brain. So first we have this primitive reflexes, and that is almost like a booting system in the brain. It's like the old computers where you put that booting system, the floppy in, and it will kickstart the whole the program. A reflex is exactly that. It kickstarts the development of the brain to function at a higher level. And then roughly at the age of 1, you want those primitive reflexes to drop away, which will allow for secondary reflexes to emerge, and then also for cortical involvement. In other words, now there's a decision. Obviously, it happens prior, and depending on the reflex, some reflexes cease to exist prior to 1. But in neurodevelopmental terms, we don't want to see any primitive reflexes after the age of 1. So as much as sucking is important for neurodevelopment, it also tells us a lot about neurodevelopment. If it's not there, or if the need for sucking is too much, then it will actually tell us a lot about the integrity of the neurology. And that is why we can actually use it as a therapy as well. So it's not only to witness what's going on and to read the signs, but you can also, we use it on a daily basis with our children that have neurodevelopmental delays. There are some important aspects or interesting aspects around sucking that not a lot of people know. And the first one is the link between sucking and the visual system. And you can perhaps try it. If you trust your own hygiene, then you can suck on your pinky and suck hard and close your eyes. And when you do that, you will feel that your eyes converge naturally. And if you think of a baby, when a baby is born and you look in their eyes, you will see that their eyes are not focused. It is as if they are slightly misaligned. And if you think about the necessity for visual focus, then you'll realize it was not necessary inside the womb. First of all, there was not enough space for binocular functioning. So the baby didn't need that activity. But after birth, we need to start to coordinate and synchronize the two eyes. And sucking is actually the activity that will pull the eyes in so that they can start to function as a unit. Because we are binocular beings, we need both our eyes in order for us to focus and to gauge distance. And as I've said, we didn't need that activity prior to birth because there's no space. There's no space to have to focus. And then when a baby is born, the distance of their focus is roughly the length of their arm. And that is why you will see babies will focus and they will look at their hands, and usually when we come into a baby, we are sort of like the length of their arm away, and you will see that they will start to pull those eyes in and to focus and to practice that. And it's practiced by sucking because the eyes converge and then they'll slowly close down. Okay, blowing, on the other hand, does the reverse. So blowing makes your eyes to diverge, and this is an activity that we actually require. We need both the sucking and the blowing activity to practice those 6 eye muscles. Around each eye, we've got 6 muscles, so those 12 muscles must learn to work in synchronization and coordination with one another. So as an example, within my practice and in my centers, we use blowing and sucking activities for children with learning difficulties and attention, because we understand the neurology and how it actually works and how it functions and how it should function. And this is a very easy activity to assist children with visual components. In terms of the oral motor, that's also extremely important. The 5th cranial nerve is the trigeminal nerve, which sprouts here. It goes into the forehead, each and every, both our eyes, each and every tooth around the ear, in our vestibular system. So whenever there's sensory information and also motor activity, then it will affect other parts. So in other words, if I strengthen or use my mouth, then actually I am working that whole trigeminal nerve. And because that trigeminal nerve is linked to the areas that I've mentioned, all of that actually gets stimulated. Sucking is also a very important indicator as to how well the child has matured. Remember, whatever we see in the body is a reflection of how well the brain is developed. So if we see a child that is struggling to suck, then it might indicate for us that that component in the brain has not developed up to the point where we actually need this activity. And with a lot of babies, that, if they're not born with the sucking activity, it usually kickstarts pretty quickly after, because of the stimulation. So if we stimulate with texture and with different sensations, then it sort of like starts to send the information to the brain, and it kickstarts that reflex. But the way a baby manipulates, or a child or an adult, I've seen adults struggling with sucking and blowing, it gives us an indication of how well, I don't want to say controlled, but the level of control they have in both sides of the mouth. Because in order for us to suck and to create that vacuum, we need to have control over our mouth equally. So if one hemisphere is sending information to the brain, and remember it crosses over, and one part of the mouth is not sucking in synchronization with the other part of the mouth, then that a vacuum will not, the seal will not happen. In other words, the baby will struggle to suck and to latch on, but it also, for me, from my point of view, it will tell me a lot about the control of the 2 sides of the face and the cheeks and the mouth, but also then obviously what's happening in the brain. Sucking is also extremely important in terms of the oral motor as a precursor to swallowing. That's not a reflex, but a mechanism. So we are moving from sucking and swallowing as a reflex to them being a mechanism that the child chooses to use. So it's the precursor to that, but then it's also the precursor to talking. Because for us to be able to talk, we have to have extremely well coordinated and synchronized activities to form the words, the vowels, to use the sides of your mouth to make the sounds, your tongue just at the right position. So in terms of articulation, there's a lot of oral motor control that's needed, and it's actually stimulated and activated by this process of sucking. Then another activity or a function of sucking is that of the sphincter muscles. So a sphincter muscle is a round muscle. So this is a long muscle, and then we have round muscles. So you've got a sphincter muscle around your mouth, your pupils, your polaric valve, your anus, and your bladder. And Dr. Beulah, there's a reference to her there. She discovered that all the sphincter muscles are linked with one another. So in other words, if I stimulate one sphincter, then actually I stimulate all the sphincters. So if I work on this sphincter, then actually my pupil will dilate and practice, my polaric valve will. So babies with reflux, okay, that is indicated. Incontinence, all of these actually work on one muscle. So if you practice one muscle, you practice all the muscles. And you can perhaps try it now. I want you to close your eyes very, very, very tightly, as tight as you can. Just pull it in, and then you will feel other sphincter muscles down below also tightened, if you did it correctly. And it's actually easier to close your eyes and to really squash your eyes if the other sphincter muscles are also being pulled in. So we use sucking for children with bladder control issues or light sensitivity, because we are working on that muscle. Okay, so very interesting how we can then apply sucking. So as much as sucking is a diagnostic tool, it's also a therapeutic tool. And that is the wonder of neurodevelopment. If you understand the brain and the body and the connection between the brain and the body, you can use these natural occurring activities as both, as an indicator as well as a therapeutic activity. Yes, we've spoken about the trigeminal nerve. I just quickly want to think if there's anything else that I wanted to say, but I can't think now. So perhaps let's just open up. Okay, so one of the most important activities that I'm thinking about now is interhemispheric integration. So if I talk about the two sides of the face and therefore the two sides of the mouth, then it implies that the child has got control, and therefore that we have the workings of interhemispheric integration. I use sucking to calm children down. You can understand it because there's a correlation between sucking and nurturing and bonding. But apart from that, whenever you use the two sides of your body in synchronization with one another, we activate interhemispheric integration, and therefore we calm down the two brain hemispheres. Because usually when there's anxiety, and you see it that is why when a child is anxious or frustrated or emotional and we give a dummy, what do you think, why it works? Yes, it is for that association with nurturing, but what actually happens in the brain is the two brain hemispheres come into, they align their activity level with one another because we've got interhemispheric integration, and then they sort of like synchronize with one another. Because when we are anxious or emotional, usually one brain hemisphere is overly active. You know, we think about all the things that's going to happen, or we are very emotional or extremely so, whatever is happening. And then the other brain hemisphere cannot come in and say, don't worry, it's not that bad. Or don't worry, you know, whatever the context is. It means one hemisphere is overly active and the other one cannot intervene to say, but stop this. And the moment we then present an activity that actually brings the two brain hemispheres in alignment, we calm down. So around the question of should a baby suck or not, from my perspective as a neurodevelopmental specialist, I would want to observe when the baby needs the sucking, or so let's talk about older children then. I'm quite happy with sucking because I know sucking helps with interhemispheric integration. But you need to then understand there's also a lot of stimulation of the oral motor and the dental component. So as long as you keep those aspects in check and you are observant of what's happening, then I'm quite happy with sucking. I actually encourage sucking. But then if it passes, I mean, I've seen 7-year-old, 8-year-old, 9-year-old, 10-year-olds really, really wanting to suck. Then I know it's not really about the act of sucking. It is what sucking provides. And sucking provides the interhemispheric integration. So if I can provide that in a different way, then usually the need for sucking ceases, and we are starting to work on the neurology, which actually provides the interhemispheric integration to provide the platform for the child to function. So Karen, in a nutshell, 30 minutes.
Just like that, on the button.
Just like that.
Amazing, honestly. Thank you so much. And I'm going to ask everyone if they would like to come on the video if you have a question. And I'm sure that there are lots of questions.
I hope I mentioned everything, Karen, because there's such a lot around sucking that's important. But yeah.
I think the big one was dummies, because it does come up all the time, because as you say, it is so controversial. And I just love hearing your input, because I know my input as a midwife and lactation consultant, and just from my experience of working with babies for so many years, that I know some babies need to suck.
It's such a natural activity. And in a way, a baby knows what it needs. The brain knows what it needs.
Too young to manipulate.
Too young to manipulate. Yes, there is this strong link with nurturing, but my main thing around neurodevelopmental activities is the observation of what the brain needs, and the brain usually tells us through the activity of the body. I have no problem with sucking whatsoever. Especially young, especially babies, and especially toddlers, and yeah.
Especially because I see that, especially newborn babies who are so primed, and because it is so reflexive. I mean, they will latch onto your nose, onto your ear, onto dad's nipple, onto your nipple, on your finger, because they are primed to suck.
And we are programmed, as you say, primed to do it. The brain, this is a mechanism. It's an innate mechanism for the brain to develop to the next level. So let me just equate this to other reflexes. So, and remember, this is a primitive reflex. A primitive reflex indicates that there's no cortical involvement. There's no cortical involvement. It comes from the bottom of the brain.
Yeah.
So if we take then something like a child moving developmentally from crawling to standing, usually before, in that period of crawling to standing, there's a lot of frustration. You can actually see it. You can feel it in there. You know, it's like, they're frustrated. But it's that frustration that allows the brain to move from its prior state to the next state. So if we as parents then go and pick up the baby every single time that they are starting to niggly because they want to get up, we deprive the brain of building those vitally important neural pathways to actually stand up by themselves. I'm not saying let your baby sit on the carpet and cry. I'm not one for crying it out. It just doesn't work. It's just not good. But I want to create an awareness in parents as to why certain things happen the way they should. And they happen in a very specific sequence, because that's the program of the brain. A baby needs to suck so that we can move on from one stage to the next stage.
And, you know, just to go back to that example of learning to walk, they're grasping and pulling themselves up. They do on their own. We don't teach them to do that.
No.
They start all on their own, and they'll fall down and they'll pick up and do it again and again and again and again. And it's because they've learned.
But it's that again and again and again that's actually making the neural connections.
Yes. Yeah. It's like when they're sitting in their high chair and throwing things off and watching and laughing. I mean, we've got to pick them up and everything, but they're learning cause and effect. They're learning, you know,
and release.
And release
the hand.
Yes.
So, I mean, okay, just to illustrate how much I believe in sucking, every single child in my school has got a sippy cup to suck. We suck 3 times a day for at least a minute.
From the sippy cup.
Eyes closed, yeah.
But is that a sippy cup with a straw or a sippy cup with a little
No,
spout?
yeah. So sorry, for us, it's not a sippy cup like a baby. It's like a straw. We use a long straw. Oh, yes. Yeah, let's talk about this. So the difference between breastfeeding and bottle feeding. Okay. We really, if possible, and I know it's not always possible, but if possible, we want breastfeeding. Because of the amount of sucking that it requires. It's much harder work to suck on a breast than on a bottle. So it's really creating a lot of pull here, and how the harder we pull here and the harder we have to work here, the more trigeminal information we get, the more visual coordination we get. It works in the inner ear, it works in the vestibular system. It also works, so it works on the pressure inside of the middle ear. It just activates and stimulates this whole system. So a good breastfeeding is really, if possible, I know it's not always possible, but if possible, what we want.
You know, I found years ago, I mean, bottles and teats and nipples and things or whatever have really come a long way. I mean, you know, there's a lot now that try and mimic that. I don't think I'll ever get it right, but I know that years ago, before we had those, if I gave a breastfed baby a bottle, it would generally finish it in 2-3 minutes flat. No matter what you did, you could do sitting ups, whatever, all the different things, but they would finish it much quicker. And then they would still be looking to suck more because they were used to feeding on the breast that took longer, that worked harder, whatever. So the same amount of milk possibly, or probably, but it hadn't hit there. They didn't have that feeling of fullness, because it's not just the feeling of fullness. It is also the sucking and the movement and the whole act of feeding.
Yes. Yeah,
that is what's giving them that satisfaction. So
it also tires them out. You know, a good breast sucking tires them out and they go to sleep. You know, it's hard. I mean, if you really, it's hard work to suck.
Which is why it's so difficult sometimes for moms who do bottle feed, and why they sometimes overfeed their babies, because their babies don't naturally go to sleep after a bottle, even though they've given them double what they would have had on the breast, because they still need to suck. And they haven't been tired out by that.
I want to sort of like also link it with, in a way, the vagus nerve and the information that comes from the vagus nerve. So the vagus nerve is the 10th cranial nerve. It's the wandering nerve. They call it the wandering nerve, that goes outside of the brain, goes inside of the body. And that is linked to interoception, which is the sensations that we have from our body. So fullness is a sensation. And it's a sensation that needs to register in the brain as well. And that also needs to be stimulated.
Is the baby's vagus nerve developed from birth?
It's developed, I want to say, prior to birth already.
Oh no, you're frozen now. The most important question. I hope you can come back. There you go, you're back again.
Okay.
Yeah,
I won't be able to answer that question in specific detail, Corinne, but the information is, it's like everything. It's like touch. No, it's like sound and light and our awareness of light and all of that. The neurons are there, but it needs, when does it become functional? It becomes functional when it starts to be activated.
Okay.
Yeah.
Okay.
I hope I've created some awareness in terms of the importance of sucking.
Are there any questions from anybody, from Jacqueline, from Claire, from Cassandra?
From very quiet.
That's it. Cassandra, okay. Claire, Jacqueline.
Okay.
None.
That's fine. Well, you can contact me if there's any questions afterwards, and then we can address that.
Yeah, well, I just want to thank you. And I just also want to say, so, you know, that sphincter thing, seeing as we're talking about it, okay? So, you know, you talk about screening your eyes, and I did it, and I could feel it.
Yeah.
Oh, there we go. That was very informative from Jacqueline. Thank you very much. When I'm teaching birth preparation, we talk about the pelvic floor and the throat. So I know it's not a sphincter as such, it's just soft muscle, and the cervix is cartilage and the pelvic floor is muscle. But we know that if your jaw is clenched and this is taut and whatever, then there's contraction in the pelvic floor, there's contraction down below, not necessarily in the sphincter, but in the cervix. Yes. And it makes it difficult for the cervix to dilate when there's tension up here. So, you know, some of the breathing things that we do, and the keeping the mouth open and keeping the mouth soft and whatever, and doing, you know, soft lips and everything, is about making sure that everything down in the pelvic floor is nice and soft.
Yes. So you use that information differently. Yeah.
But yeah, it definitely, it's interesting though, hearing it from that perspective as well for the baby.
Yes. And then also this can be used for mothers after a natural birth.
What do you mean?
Sucking.
You mean for the pelvic floor?
Yeah, for just to
or vagus and
and for incontinence or any, just to sucking is such a good activity for a female to do.
Okay.
Straw sucking. Yes. Like older ladies. Okay. That's incontinence. It's just to suck from a straw. And when I say straw, I'm not talking about a normal straw. We have specific straws that are usually very long, very thin, and it's a twirly straw, so that when you suck, it's a real hard suck.
Okay.
And it helps with light sensitivity, and bladder and bowel control. It helps with that.
Okay, sure. So Claire's got a question. What age should babies stop breastfeeding from the development of sucking reflex?
No, I would, you can come in here, Karen, because breastfeeding has such, it's got more than the sucking component that is involved, and here it's more in terms of the nutritional component and all the amino acids and everything that a baby can gain from breastfeeding.
So from the nutritional components, we
yeah.
recommend exclusive breastfeeding for the first 6 months is what is recommended. And around about 6 months is when you're going to start weaning baby and then adding all other things in. And obviously you can carry on for as long as you like then, and it might just be a natural weaning off as you start introducing more solid feeds, and the baby will naturally drink less and less, and that might take 2 months and it might take another 2 years. It also depends then on your preference. But you know that if you've done exclusive breastfeeding for the first 6 months, you really have given them optimal nutrition and everything that you possibly can. And at the same time, if you have done it for 6 months, then carrying on is probably easier than, because you've actually gone through the challenges. The first 6 weeks is the hardest, without a doubt. And if you get through the first 6 weeks, and the first 6 months is not that bad, it's certainly much easier. And once you've got to 6 months, then it is just easier to carry on. But yeah.
I don't think from my perspective, from a neurodevelopmental component, there's no, it should stop. So if you've breastfed exclusively, started to introduce, and you find that your baby then does not want to suck as often because he's now getting all his nutrients in a different way, then I would still like to gently encourage sucking, and that is when you can introduce the fluids in a sippy cup. Because then I still get the sucking that I want, and it is in an appropriate way, and it helps in, there's no deprivation.
And those sippy cups these days are great because they're designed that if they fall over, it's not going to come out. So they actually have to work quite hard to get the liquid out.
Yeah. And I think they are also designed with, all the dental components and, taken into consideration. So I would still like some encouragement to suck then to get fluid in.
And a lot of the sort of fancy soft foods that you can get come in like little pouches that they suck as well. But be mindful that you don't always want to give them those, because they also need to learn to eat with a spoon. And you also want to give them that autonomy of working with their gross motor skills to pick up the spoon and bring the spoon to the mouth. And to also start bringing in food that's a little bit more solid, that isn't just suck and swallow, suck and swallow. They need to learn to move the food around their mouth and swallow too. And something that's a little bit more solid that they need to chew.
Yeah, and all the textures, smell, touch and taste, in terms of, but in terms of the sensory component is extremely important.
Yeah. And to be able to see their food in front of them is also good, and to be able to play with it because of the texture and the sensory.
Yeah.
Yeah. There you go. See what happens when we start chatting. You just go on and on and on. What age did you stop using a dummy?
Okay, so I'm going to continue to encourage sucking, but in socially appropriate manner. So as an example, and I'm just going to mention it, I mean, I've had children in my center, 10 years old, having a dummy. Obviously, you don't want that, okay? But again, it tells me something about the neurology. So for me, way more important than saying, well, at 2 you should stop, or at 3 you should stop. It's not, for me, it's not about that. For me, it's about what does the baby or the toddler communicates via their activities. So is it a very strong need to suck? And because you get those, that's extremely, they have to suck. And if you don't give them the dummy, they will suck on their, or then they'll suck, or they'll suck on whatever is around them. Then in a way, and if you understand neurology, in a way, it's cruel to take away the vice, because something in the neurology needs that suck. And it's like, if sorry for this analogy, but this is what's popping up. It's like when if you take away the walking stick of a blind person, they need that. If you've got that child that's really, really, really in need of a suck, to take the dummy away is not beneficial. The counter then is to get your neurodevelopmental profile of the profiling of the child, and then to determine why this child really, really needs this suck so desperately, and then start to introduce other activities that will actually assist with the integration of the two brain hemispheres. Yeah, so I actually don't want to say an age, because it really depends on neurodevelopment. After birth, there are certain intervals that are extremely important. So 2, 3, you would want to start to see a child, not, but it really depends on why they need. For me, the question why is really, really way more important than the act of sucking. And usually what happens in most children, that sucking is replaced with something else, like a sippy cup, because the oral motor, and then from the sippy cup, it moves on to a cup, and then it moves on to spoons and having things inside the mouth, and it moves on. So usually there's this natural progression towards not needing and not wanting and not all of that. But I would be concerned, I actually want to say around 4. I don't know, Corin, what do you say?
Yeah, around 4, because at that stage there's so much else going on, and they socialize, so they're playing as well. So you'd like to think that they'd be able to play and they're talking without money.
I wanted to say, so language is also a very important thing. And if this starts to inhibit that, then I would also start to think to replace the dummy. So it's every time it's to replace it with something that is more age appropriate. So from the dummy to the sippy cup, and from the sippy cup to the next thing, and and as I say, it's then utensils in the mouth, because it's not that they suck, but they get used to things. And then so yeah, I would really want to understand why, but round 3, 4, I would be sort of like, this is now, we need to move on.
And I think also, when you do introduce it, because people always say, because of the controversy around it, and when it's introduced, it's usually in the first few weeks, because that's when they need it. That is when they display the need to suck. And tell me if I'm right here, but the advice I usually give is that go back to the American version of a dummy, which is a pacifier. So use it to pacify, and when they don't need pacifying anymore,
don't give it,
then they won't need it. And sometimes it's just as simple as popping it in when you're changing the nappy, because you've taken their clothes off and then they're all over the place, and you've taken the boundaries and all of that, and then it just gives them that thing. And now I understand it better as well, because it brings their attention inwards.
Yes, it comes. It literally does this, and then this.
Yes, and you see them.
Yeah, hopefully you would want to be able to do this and this with other activities, like talking and your calm voice, and music and other activities. And then when that happens, the dummy sort of like just accidentally, you forgot it in the car, so it's not readily available, and then then you wash it, and it, and then, it's not as visible and as available, it just starts to, the dummy finds a life of its own. And most of the children are happy with that. But if you get that child that visibly need the suck, because then they'll start to suck something else, those children, we understand that we need to assist them specifically with interhemispheric integration.
With your newborns, there usually is another something else that you can use if you haven't got the dummy, or you haven't, you've left it in the car or something,
Yeah,
because then
no, yeah, I mean, that is for weaning, if you start to wean.
Yeah. But I mean, for the newborns,
Yeah.
sucking is just one of the things that's going to calm them, but some of them need it more than others. Some need more calming than other babies. And we can actually feel it in their body. If you're holding them when they start sucking, you feel them soften.
Yes.
And relax. So,
okay.
And I just want to have a little story, because I worked last night and had a newborn baby at the thing, and it was when you were talking, I was just reminded of the beautiful reflex of sucking, that when you place a baby on its mom's chest and you leave it undisturbed, it will start sucking with minimal intervention or fussing or whatever. And this little one did exactly that, and it's always just so beautiful to see. And that is exactly that. It's just a reflex. So yeah, nice.
Yeah, and the importance of smell.
Yes.
During
Especially
that
smell.
phase. Yeah. So important.
Yes, and that's something to remember as well. When you're calming your baby and you wonder why somebody else manages to calm the baby easier than you, it's because, they can smell your milk sometimes and they just want to be on the boob. So sometimes you do have to give them to dad or somebody else if they're fed.
Yeah.
Thank you so much, Beulah. I really appreciate it. Thank you for your time. I'm sure it did. I know it did. It's always lovely getting such information. And I think it just, as you say, parents will make their own decisions, but to have a deeper understanding of what's happening in their baby's body and in the neurology and the science behind it definitely helps you. And I think also eases some of the stress and anxiety around, when you're holding your baby, or when if they are sucking a lot or whatever. It just, okay, this is actually a developmental skill, and it's a reflex, and it's something that's really good for them, and what's going on in their brain and all of that. So I think it's just really reassuring.
Yes.
Yay.
Okay.
Thank you,
My pleasure.
See you all tomorrow. I'm going to end.
Okay. Chat soon.
Yeah, I'll give you a call now.
Yeah, okay. Goodbye.